This video is to highlight the features of Biotronic's dual chamber ICD. I believe if you were to think logically and rational when deciding which dual chamber ICD to implant, you would come to the conclusion that Biotronic's device needs to be at the top of mind. Please feel free to give me any feedback or pushback whatsoever. Thank you. Okay, here it goes. Atrial ATP combined with CLS plus longevity equals Medtronic's dual chamber ICD with reactive ATP. Atrial ATP is a feature that allows a physician to program a single ATP therapy for a rhythm in the AT zone. The rhythm in the AT zone must be regular, plus or minus 40 milliseconds, such as atrial flutter or sinus tachycardia. When 36 out of the 48 events are above the programmable AT or AF detection rate, nominally the detection rate is 200 beats per minute. If the rhythm is considered stable, ATP is delivered. The Burden 3 trial compared CLS to accelerometer. The trial had 1,160 patients, randomized 3 years in length. That's not bad for an industry study. CLS demonstrated a 16% lower risk of high atrial rates, 23% lower risk of high atrial rates in patients with intact AV conduction, and a 27% lower risk of high atrial rates in patients with no history of AFib and intact AV conduction. I know you've all heard every device company talk about how their device lowers the risk of AF. So I'm just reporting the news on the Burden 3 trial. Please, I encourage you to read the study and check it out for yourself. It's probably in your mailbox as we speak, as I sent that email last week, or more likely in your trash box. Totally understand if it's there, but please feel free to check it out. Okay, quick note on longevity. The Biotronic dual chamber ICD lasts 13.5 years. The Medtronic Cobalt XT is 11.9 years, and the Avira, is 10.5 years. So in conclusion, Biotronic's dual chamber ICD, when you combine atrial ATP, CLS in the Burden 3 trial, and the longevity, which is 13.5 years, is a very competitive device compared to other vendors. Thank you for your time.